which deals with joints, or more correctly, articulations. So, joints or articulations are the places that are junctions between two bones. We often think of them as movable, but they are not in all cases. Their function is to bind parts of the skeletal system together. They also allow for bone growth to be possible, especially the length of long bones. They permit parts of the skeleton to change shape during childbirth, and they enable us to move our body in response to skeletal muscle contractions. Many of them act as levers for our skeletal muscles. They are classified into three big groups: fibrous, cartilaginous, or synovial. And they are also classified according to the amount of movement that they use, so a functional classification. They can be synarthrotic, which are immovable, amphithrotic, which are slightly movable, or diarthrotic, which are freely movable. But remember, when we say freely movable, that is within the confines of the shape of that particular joint. So a fibrous joint is held together with dense connective tissue that has many collagen fibers. They are bones that are in close contact. They can be a syndesmosis, a suture, or gomphosis. The first one we'll look at is a syndesmosis, in which the bones are bound by a sheet of connective tissue, often referred to as an interosseous membrane, or membrane between two bones. It's a bundle of dense connective tissue that may also be closer to a ligament in shape, so an interosseous ligament. These tend to be amphithrotic. They're flexible. Some of them may twist. We find one between the tibia and the fibia. We also find it in the forearm bones. Sutures are between flat bones. They're most recognizable in our skull. There's a thin layer of connective tissue called a sutural ligament that connects the bones. These are synarthrotic. They are immovable. They do not move at all. A gomphos is a cone-shaped bony process in a socket, and it's only found in the jawbone. It is where our tooth is embedded in our jaw, and it's held in place by a periodontal ligament. It is a synarthrotic joint. It is immovable. But it's important to remember that your teeth are held with an articulation to a bone. Cartilaginous joints are connected by hyaline cartilage or fibrocartilage. There are two major types of cartilaginous joints, either a synchondrosis or a symphysis. In a synchondrosis, there are bands of hyaline cartilage that unite the bones together. Some are temporary, such as the epiphyseal plate we talked about last week, which is an ossification center, turning it, allowing for the length of long bones to increase, and then it becomes a synthosis. Between the manubrium and the first rib, the costal cartilages, these are permanent synarthrotic cartilaginous joints. A symphysis, on the other hand, is a pad of fibrocartilage between the bones. It covers articulate surfaces. Those surfaces themselves are covered with hyaline cartilage, as we'll see more later when we talk about synovial joints. These are amphithrotic. They allow for limited movement. A good example of this is the pubic symphysis. And also the joints between the individual vertebrae, what we will have and will refer to as the intervertebral discs. Synovial joints, most of our joints are synovial joints, and these are all diarthrotic joints, meaning they are freely movable, but they are freely movable within the confines of the geometry of the articulation. In a synovial joint, articulate cartilage is going to cover the articulating ends of the bones that come together or nearly come together. There is a joint capsule associated with a synovial joint. It's made up of two layers. The outer is a fibrous layer composed of mostly ligaments. The inner layer is a synovial membrane, and cells within that synovial membrane secrete synovial fluid. So the potential space between two bones is filled with synovial fluid. Synovial joints are more complex than the other types of joints we just talked about. They all have the following parts. There is an articulate cartilage on the ends of the bones that are articulating with one another. The joint capsule we just described briefly, which includes ligaments, and there are other ligaments as well. The synovial membrane, which surrounds the synovial cavity. That synovial cavity is filled with synovial fluid. There are also meniscus or menisci in some joints, or bursae and bursae in other joints that help to make them move more smoothly, and we'll see them when we talk about specific synovial joints. In the knee joint, we show the typical synovial joint structures as well as the menisci and bursae. You can see here, there's our femur and our tibia, which are the two articulating bones. They're covered with articulating cartilages. There is a meniscus in the front and in the back. There is a bursa around the tendons, and synovial membrane and synovial fluid fills it. Types of synovial joints that exist come in 6 basic kinds. They're classified by their shape and movement that they allow. So this is where I say they're freely movable, but only within the confines of their shape. So we have a ball and socket joint, which is also called a spheroidal joint, although I've never heard that term used. It's a round head in a cup-shaped cavity. It has the widest range of motion. It is multi-axial, and it allows for rotation. We find it in the hip and in the shoulder. In the hip, the socket is quite deep. In the shoulder, it is quite shallow, which is why it's easier to dislocate the shoulder than the hip. A condylar joint is also called an ellipsoidal joint. An oval condyle fits into an elliptical cavity. It allows for back and forth and side-to-side movements, so we get biaxial movement, but we don't get rotation on there. This is best exemplified by the joints between the carpals and the phalanges of our hand. A plane joint is also called a gliding joint. It's almost flat, a little bit curved perhaps, allows for back and forth and twisting, non-axial movements. We have these in our wrist and ankle joints. A hinge joint has a convex surface that fits into a concave surface on the other bone. It allows for uniaxial movement, only in one plane, and the elbow joint is a good example of a hinge joint. Pivot joint is also called a trochoid joint. It has a cylindrical surface rotating within the ring of another bone, allows for uniaxial movement, and that movement is rotation only. The first cervical vertebrae, C1, the atlas, and the dens of the second cervical vertebrae, C2, the axis, is an example of a pivot joint. Saddle joint is also called a sellar joint. Both bones have a concave and convex surface. It allows for biaxial movement in 2 planes, and a best example of this is our carpal and metacarpal of the thumb that allows for opposition of the thumb. I'll stop this lecture there.